Okay, so we'll get started then. And again, there's a few of you in the audience that I might call on because you might have some information that I don't have, and I would love to hear more from you. So this map is a map I used when I did my dissertation work, and I've held on to it. It's from several years ago, but the most recent studies have shown that we have not improved. We're not getting any better. So I like to hold on to this map. Louisiana and Mississippi fall at the 60 to 64% of not understanding what they are being told. And that's not just with health literacy, that's literacy in general. We know that health literacy is even more complex, and so the problem's even bigger than we know. Then Alabama, Georgia, all of these southern states, and even up toward Kentucky, they fall at the 53 to 59%. So remember that map, and look at this. These are activities by the Center of that the CDC has listed on their website, and this is a great map. And if you just Google CDC health literacy, all of this will come up for you. And you can go to each state, and hyperlink will come up, and you can see what is going on in each of those states. So it gives you a lot of information. So let's start with Arizona. Arizona has established this in 2009, and it's really sort of across the board. It involves literacy councils, it involves providers and educators and families. I could not really determine how they're getting their funding. And that's the most important part, isn't it? The Canyon Ranch Institute is in Arizona as well, and Andrew Pleasant has done a tremendous amount of work. Richard Carmona also is at the Canyon Ranch Institute, and Dr. Carmona was our Surgeon General when a lot of the health literacy initiatives began. And so there is a paper that Andrew wrote that has got a very comprehensive list of all research activities as well as coalitions and partnerships and so forth that have about a paragraph or more for each state. And I encourage you to go to one of these links. And all of these will be posted on the ADPH website, we're hoping. We're going to find a website to put it on, but we're going to hope Tom Miller will do that for us. And so I encourage you to look at these studies because they're very comprehensive, and we certainly couldn't, it'd take all day to even go through half of it. And then Arkansas, we're very fortunate today to have Jennifer Delahaye, who will tell us what they're doing with their Department of Health. But they also have one of their universities that has a Center for Health Literacy. Florida, one of my great colleagues, Kathy Mead, is here today, and she is from Florida and has done a tremendous amount of research in cultural competency and health literacy for cancer patients. And you can see Blue Cross Blue Shield of Florida is providing some grant funding for this. Georgia Alliance of Health Literacy, one of my colleagues is actually involved in this. I worked with her for her DNP project as a doctoral student. And they brought together basically what we've done today. They've brought together all kind of stakeholders together for this alliance. Now theirs is a little bit different. They operate on donations and membership dues. And I'm not sure how active they are, but they've got a pretty good website you can go to. Indiana University, Purdue University at Indianapolis, has got a intercultural health literacy and communication program. Kansas is really a pediatric focus, and theirs is real different. It's very interesting when you look at it, and their funding is from the United Methodist Health Ministry Fund. Obviously they've got philanthropy involved. Sunflower Foundation. I don't think we have a Sunflower Foundation, but I know we've got foundations that we can partner with. Kentucky definitely gets the award for the best looking website. They've got a really cool website. It's very colorful. And if you look, this is really sort of what we did today. We brought together state government, local public health departments, universities, AHEC centers, community health centers, libraries, insurance companies, and more. So they've got over 35 organizations. I could not tell from their website where their funding comes from. Maryland, if I'm not mistaken, Maryland's Horowitz Center for Health Literacy, they had a study a couple of years ago about infant mortality that was really interesting, and so I've got that I can share with the group. And then this is Central Mass Health Literacy in Massachusetts, and this is actually run by 4 or 5 nurse researchers. And they're doing smaller quality improvement type of projects that are really kind of at the grassroots effort. Then you've got Harvard, which really may have been one of the first schools to really focus on this. Dr. Rima Rudd is, along with Terry and some others, are kind of like the gurus that started this movement, pioneers in this area. And there's lots and lots of web-based presentations that Dr. Rudd has done that you can find online. And they've got a tremendous amount of support up there. Minnesota is one of those that has done this really, really well. They've been in existence for a good while, and theirs is really consumer-based driven as far as how they actually promote their program. They've got funding from lots of different sources. Here they are, all their partners. You see all the insurance companies as well as the Department of Public Health, their Literacy Council, Pediatric Home Service, and so forth. And this is the Donald Trump of health literacies. Yeah, everything's great. They are really the best. They've got tremendous funding. You just got to go to this website. They've gotten an Emmy Award for some of the work that they've done with film and video to create materials for patients. And then Nebraska. Nebraska is one of those that you can't really tell a whole lot by going to their website. But most of these websites, if you look, you've got the resources, about us, join us, events, and then most of them are having summits annually. And what those summits are comprised of are really folks from all over the state that are going to be working in the trenches with patients, as well as literacy councils, hospital systems. It depends on what state that you go to, but a lot of them have those types of things. And then the North Carolina Program on Health Literacy is affiliated with UNC, and it involves research as well. And then the Ohio Collaborative for Clear Communication is affiliated with their AHEC. We have our AHEC representatives here today, yes. And you know, that might be a really nice fit for some of what we would like to do here as we move forward with planning. And then Oklahoma is one of those that's just kind of, you can't really tell a whole lot by what's on the website. Pennsylvania is really patient-oriented as well as provider. You can see these little tabs down here for healthcare providers and for consumers. And then Vanderbilt has got a tremendous program of research. Dr. Russell Rothman heads that up, and they've been doing this for a good while. And if you look at this lineup over here, these are superstars in the research field. Texas is more community-driven. A lot of literacy councils are engaged. Some health systems, it feels to me more like a literacy council than a health literacy council when I look at it. And then Wisconsin, they've been doing this a very long time too, and they've got some wonderful volunteers that have done a fair amount of research, and they hold summits as well. So, what are we doing in Alabama? Well, we're starting. We're not sure where we're going to go with this, but we know that we have a problem and that we want to try to do something. So one of the early wins for the task force was getting the governor's approval and task force approval for the State Department of Public Health to add the behavioral risk factor surveillance system questions from the CDC that was recommended. Cindy Bauer and her team did a lot of work to establish those so they were psychometrically appropriate and would gather the data that they want. So beginning in 2016 in January, we began to add those to ours. So it'll be a while before we know. And this is really from the IOM Vision for a Health Literate Nation. And if you look at all the different agencies and partners that they have recommended that have to be here in order to establish a true collaboration, Education is up here, and they recommend health and science, K through 12. I know some of our schools are doing a really good job with that, but I'm not sure that it's systematically done. And so healthcare professionals education, adult education, and then literacy for those that don't read at a fifth grade, can't even read at a fifth grade reading level. Business is really, really important to this as we move forward, because who is impacted by folks that are out or sick for a very long time? If they're workers, think about how our businesses suffer. And so I really believe business will have an opportunity to join us and make a big difference. Government, that's an obvious fit. The healthcare system's obvious fit. And then community-based supports infrastructure through the healthcare as well as education. Home-based healthcare, that's something we're seeing more and more of. And John Beard is here with us today, and he's loving that. But his company is doing a great job. I know I have worked for John, and I can tell you they have got some provider initiatives that they're working with all their home health care nurses to make sure that they're doing a great job with medication reconciliation. And so it starts really at those levels. And then media has a role in this. They can help us get the word out. They can do a lot of things to help promote what we know we need to get established across the state.